Hi, I'm Jo Butterfield and I work on the West Yorkshire Mental Health STP programme, so a bit of a mouthful. And I'm just going to talk quickly about the STP model, particularly in West Yorkshire, and what its ambition is, if you like, and then potentially how we fit primary care mental health within that. So I'm sure you will all know there's 44 STPs in the country. So these are focusing on sustainability, transformation and planning. Ours is the West Yorkshire STP. We serve a population of 2.64 million, have a total allocation of 4.7 billion across the health by 2021, and with a health and social care workforce of 113,000 staff. As you can see, there's partner agencies on there as well, such as the police, local authorities are all engaged as well. Do I just click on that? Yeah. So the leadership aim and principles around the STP, well, particularly around the West Yorkshire STP, is to ensure that we'll be ambitious for the populations we serve and the staff we employ. The STP belongs to commissioners, providers, local government, and the NHS. So it's not just a committee, but I think sometimes it's seen as just a commissioning programme, but it's much broader than that. And it's actually about breaking down the boundaries between commissioning and providers. The idea is that we will do the work once, so avoid duplication of systems, processes and work, and recognising that can be wasteful. And we'll undertake shared analysis of problems and issues on the basis of taking action. But don't worry. So, it's really key to point out that the STP isn't a programme that has taken over, if you like, the West Yorkshire local plans. Each of the 6 areas still have their local plans, and it's a very much bottom-up exercise. So local plans were developed, and then there was discussion around what could be looked at within those plans collectively. So these are the areas that have been identified across the West Yorkshire STP. So cancer services, urgent emergency care, some specialist services, such as stroke, standardisation of commissioning policies, acute collaboration, primary and community services, mental health and prevention at scale. So those are set out in the West Yorkshire STP programme. And then under each of those, there's another programme of work. So I'm involved in the mental health one. So in determining what actually gets on the STP programme, there's a little test, if you like, to do. The 3 questions that are asked are, does the need require critical mass beyond a local level to deliver the best outcome? Do we locally need to share best practice to achieve the best outcome? And then will working at a West Yorkshire and Harrogate level give us more leverage to achieve the best outcomes? And I think there's something about scale and pace there as well. So just recognising it's quite a unique health and social care partnership. Our STP exists to improve outcomes for local people and deliver the 5-year forward view. It's the 3rd largest health and social care partnership in England, so it's quite a big population size, and there's a raft of, recognise that there's a raft of expertise across our patch, and there's something about sharing that innovation across the wider footprint. So new ways of working, obviously we've got the different localities, the 6 place-based delivery units. Then there's some collaborative groups that are in existence. I won't go into detail for this, the slides are just there. You'll have those slides, I'm sure, to take home, won't they? And then there's the 9 programmes that I referred to earlier, which are sort of specific programmes. And then there's a number of enabling work streams as well. So workforce, governance, digital and interoperability, strategic commissioning, innovation and best practice, and harnessing the power of communities are all seen as enabling work streams. So the West Yorkshire Mental Health Programme overview, these are the priority areas within the mental health programme. So we've got urgent and emergency care, suicide prevention, care closer to home. So some of that is around the bed base that we've got in our system, and some specialist services. We've also got a pathway around autistic spectrum disorder and ADHD. And then under that, there's also some commissioning priorities. So there's just a few names for people to have really around who's involved in which work stream. So, and the lead will be from one geographical area, and then the reserve will be from another. And then the West Yorkshire Commissioners meet together to sort of discuss interlinks between programmes and to ensure that everybody's comfortable with the way things are progressing. There's also a number of collaboration areas, such as outcomes-based commissioning, personality disorder, inequity, and we've also just recently added mental health and physical health integration, so recognising that that's a thread, that it's not a programme in its own right, but it's a thread that should be embedded all the way through this programme. And we should be also influencing the other programmes. So yes, it's recognised that it's part of a mental health programme, but for example, I'm now having dialogue with the primary care work stream of the programme to say, how does mental health fit into that? And that's me.